So, thank you guys so much for joining us tonight. We are excited to share the peptide with you. I'm Amanda Johns. If you are not familiar with me, I work at the Jacksonville Health and Wellness Center. I'm one of the practitioners, holistic health practitioners over there, and I love all things wellness. So, tonight I just wanted to introduce Dr. Rapoli if you have not met him before. He is the clinical director at the Jacksonville Health and Wellness Center, which is our brick and mortar in Jacksonville, Florida. He has over 25 years experience and has treated, over like 10,000 patients. And visionary behind the Wellness by Design, which is a practitioner program that we have as well. And then he's also the author of Illness to Wellness. So I know that he has so many things to share with you guys tonight, so I don't want to take up any more time. Dr. Rapoli.
Thank you, Amanda. And all right, we got a great crowd here tonight. Thanks everybody for showing up on Thursday night. Yeah, I'm excited to present this because it's really the cutting edge right now of health and wellness. And so there's a potentially, well, the way that I look at peptides right now is that a lot of times we're searching from a physical perspective and even from a spiritual perspective outside of ourselves. And peptides, are naturally produced by the human body. It's tens of thousands of peptides that are produced. And so we're really looking to see what the wisdom is inside the body, right? Because that's really where everything's at. And seeing if we can mimic it. And I can tell you, there's a right way to do this, and there's definitely a wrong way to do this. And so that's really one of the most important things that I'm here tonight to talk about because the access is open, for peptides everywhere at this moment. But I want to kind of create a framework just to show you to be careful and to show you how to use them in a very effective way. And so I'm going to share my screen. We're going to get right into this because there's quite a lot of information. Okay, cool. All right, so what we're going to cover today is what are peptides, how they're made, how they work. We're going to give you what's called the intelligent use framework, and that's kind of what I was just talking about, right? There's a right way to do this and a wrong way to do this. And so, the reason why I got into, the peptides was really looking at I want to use peptides, but within the framework that I'm used to, which is from holistic and functional medicine. And a lot of times people are using them erroneously or potentially what I would call the wrong way. And so we developed what's called the intelligent use framework. And I'm going to give you some tidbits of some things that are really important to do while you're using peptides. We'll talk about the different peptide categories from weight loss, muscle enhancement, recover, beauty, performance, anti-aging, longevity, hormones, energy, things that pretty much no one cares about right now. Of course, this is like, it's really touching on almost everything that we care about. And that's why peptides have become so popular. Where to purchase them, different routes of administration, who they're for, and of course, who they're not for, how to choose the right approach. And then at the end, I put in the chat for you guys a questionnaire that you can fill out. It's not going to be AI driven. I'm actually going to be looking at them. Our team is going to be looking at them personally, human eyes on them, and we're going to be providing you with potentially what could be, some of the top peptides that might be helpful for you, and different ways that you could potentially use them. Medical disclaimer, this is for educational purposes only, not medical advice. Consult your healthcare provider. And, we talk about peptides and what they can do, but of course, as peptides enter into the human body, they can act differently for everybody. So obviously results, can vary. Amanda already introduced me, so I'll skip this here. All right, so peptides can support energy and mitochondria. Those are the little factories inside every single cell in the human body. Muscle gain, people who are struggling to put on muscle or people who are struggling to take off weight or fat, adipose tissue, weight loss. And then some people, are, in some ways, they're normal weight, but they carry a lot of visceral fat, right? So some peptides can really target the hard to get type of fat, which is called visceral fat, which is the fat that sometimes surrounds the viscera or the organs, specifically like the liver and the heart. Peptides can support skin and hair, autoimmunity, sex hormone production, especially the growth hormone analogs. So, as we get older, our sex hormone production oftentimes decreases, our growth hormone production decreases. And the question is, can we return the body to anti-aging or longevity levels, that of mimicking a 20 or 30-year-old? It helps with stress, with thyroid, musculoskeletal injuries, whether it's spinal, extremities, muscles, tendon, ligament, discs, gut health, things like ulcerative colitis or irritable bowel, metabolic health. And those metabolic, a lot of times it implies like, insulin resistance, diabetes, anti-aging, longevity, and libido. So what exactly is a peptide? So everybody knows what proteins are, right? We have carbs, fats, proteins from the different food that we eat. And most people know that proteins are made up of amino acids. When you take the amino acid and you string it together, by definition, if you string 2 to 50 amino acids together, it's called a peptide. And that's a general idea because, there are some peptides that are a lot larger. When you take that peptide and you combine it with other peptides, you create polypeptides. So poly means many, so many peptides. And then when you take these polypeptides and you combine them, you can make greater and greater three-dimensional structures called proteins, right? That give structure to our body, like muscles. I like to think of it, the protein is like the book or the paragraph, and the peptide is like the sentence or the sticky note. It's very precise. It gives a specific message. So now that we understand what peptides are, the next question is really, how does the body actually make them, right? So it all goes down with the DNA. The DNA makes over 20,000 types of proteins, and our body probably makes somewhere in the lines of tens of thousands of peptides. But basically, what happens is we eat food, the proteins get broken down by our digestive system into, amino acids, and then the DNA, it is really the master at taking those amino acids and making different types of proteins. And depending on the environment, right, that the body and the DNA is bathing in, these little scissors come called proteases, and they start cutting the proteins into specific messages that are needed to travel distances, right, in order to convey certain messages. So we go from a full story to a very specific sentence or a specific instruction. So how do peptides work? We use a lot of pharmaceutical medications, and I like to think of them as like, when it approaches the cell, it knocks the door down, right? It's just very obtrusive. But a peptide is very specific. It works with that lock and key signaling mechanism. So on the cell surface, there's a cell membrane, and they have different receptors. And a peptide, like a key, is going to fit into a very specific receptor or lock and open it and create a signal cascade that's going to convey very specific information to happen within inside the cell. Now, if the peptide is traveling long distances and is made by an endocrine gland, like the pancreas or the testes or the ovaries, we call it a hormone. And those are endocrine. It's traveling long distances. So some of the peptides that are made are actually hormones, right? Paracrine, para basically means around. And so peptides can actually communicate from cell to cell, from one cell to the other cell. And auto means self. Or peptides can actually communicate with inside the cell. I mean, inside the cell is like a little city, right? There's all these different organelles that are in there. And so, there's communication that has to happen with inside the cell too. The peptides really create what's called a pleiotropic effect. So, in our office, in our school, we teach this concept called, or we tell, patients and our students to get rid of the old idea of cause equal effect. There's no such thing, right? It's causes equal effects. Even peptides that have a very specific signal, it's like a more of like a sentence, still has these pleiotropic or multi-level effects on the body. Everything from affecting the brain and metabolism and immune regulation, cardiovascular health, sleep and recovery, and the list, goes on and on. The poetry of peptides is important to kind of keep in mind as, we think about them and we use them. Peptides do not create potential, they reveal it. They are not signals. I'm sorry, they are signals. They're not substitutes. They don't override the body, they work within it. They amplify your diet and lifestyle, what's already present, whatever habits that you're currently doing. And they remind the body, if used correctly, of its own language of renewal. Another concept that we always bring to the table, and we wanted to apply it, right, to peptides, is this concept of first things first. You concentrate on the fundamentals, diet and lifestyle, in combination or before you use peptides, right? So I'm going to pick a little bit on GLP, right? Weight loss drug. But, we're seeing a lot of people come in on these weight loss drugs, not willing to make the diet and lifestyle changes that are necessary. And they're losing somewhere in the line of 50% of their muscle mass. That is not healthy. The greatest and strongest organ and predictor of longevity is the ability to hold on to your muscle. And if any of you have worked out, you know how hard it is to put on muscle, to put on pounds of muscle and to keep it there and to maintain it. It takes work. And so if you're losing 50% of your muscle, what is this doing to our longevity? We're looking better, but does it necessarily convey wisdom in the sense of, are we going with the peptide or are we going against it? So it's so important that when you start taking peptides, you lay down the foundation alongside taking the peptide. It's going to amplify whatever it is that you're currently doing. Maybe not right away, but long term. And so we don't know, to be honest with you, the long-term consequences, because this is relatively all new. So this is our intelligent use framework. Things for you to just think about. Foundation before function, exactly like we just talked about. Peptides don't replace nutrition. They don't replace movement, sleep, stress regulation. They amplify what's already present. Now, you can take a peptide as an example. There's a peptide, for helping with hair and skin beauty. You can take it, it's a signal. But if you don't have the raw materials, right, like amino acids to build muscle and all of the minerals that are needed, it's not going to work, right? Because it's a signal, right? So you need to make sure whatever peptide you're taking, your supplements are actually, you're choosing the right supplements, I should say, that are going to ride alongside the signal mechanism. Rhythm is important. Peptides should be pulsed, not constant, because the body thrives on cycles of activation and rest. Context determines the outcome, right? The environment, again, that the DNA is bathing in is going to amplify the peptide and the production of more peptide. So when you look at your blood work and you're looking at your sugar levels and your inflammatory markers, you're looking at oxidative stress, you really need to pay attention to the context or the environment. Amplification, not override. Peptides enhance existing pathways. We don't want to force unnatural processes. And so when you're stacking, 5, 6 peptides and you're taking them constantly for, over a year, that's overriding. That's, not listening. That's excessive. It's not precision. So dosing, timing, and duration all matter. More is not necessarily better. And then strategic support, not permanent dependence. We have so many medical doctors giving GLP medication to their patients and hinting or telling them they will be taking it for the rest of your life. Run away from practitioners that tell you to take peptides forever. That is not appropriate, right? There's a right way to do this and a wrong way to do this, and common sense dictates that. So we're going to talk about peptide categories, and then we're going to dive deep into some star players in peptides, and then give you some hints on, what one's particular peptides might work for you. So we broke it down into about 6 categories, and there are more, but these are kind of some general categories. We have metabolic. This is, energy, weight regulation. We have repair and regeneration of tissues and cellular renewal. Performance, growth hormone. This is for, strength, muscle building. There's cognitive, mood, libido enhancement. These are kind of more neuroendocrine type of peptides. Immune inflammatory balance for, helping control, like even autoimmunity, things of that nature. And then we have just, straight on longevity and anti-aging type of peptides. So we're going to start with performance and growth hormone optimization. So the question, right, again, is can we, take our body and begin, by age 50, right? You've lost about 50% of your growth hormone production. And what if we pulsed, a couple times a year, an increase in growth hormone production? What kind of effect would that have on the human body? So, in order to understand this, it's really important first to look at what the human body does naturally. Because remember, peptides are basically signals that the body already does. So, in order to understand peptides, it's basically just learning human physiology, right? So, the brain has a gas pedal and a brake pedal for growth. And the gas pedal is called growth hormone. And this is the body's growth signal. It will increase muscle, it will decrease fat, it will help with recovery repair. It actually helps tremendously with sleep. The vast majority of your growth hormone is produced, during your REM cycle of sleep. And it also helps to protect your immune system. And then the brain also produces the brake pedal called somatostatin. And that does the opposite. It decreases growth hormone, it conserves energy, maintains hormone balance, and it protects the body from excessive, growth hormone. And like you're going to see throughout the story of all of these peptides, right? There's an agonist and an antagonist, right? There's a gas pedal and a brake pedal. And the ultimate goal, and it's different for everybody, is the Goldilocks rule, right? We want to have balanced growth hormone. That's going to give us the optimal health. So I think from a teaching perspective, it's always helpful to understand extremes, right? If you had, some abnormal cells in your body that you didn't know, or and you were pushing a lot of growth hormone, theoretically, right, you're going to turn that abnormal growth and turn it bad, right? I.e., like cancer or something of that nature. And then, of course, you don't have enough growth hormone, right? You're not growing, right? So we want to have, again, the Goldilocks rule when applied, to growth hormone. There's 2 major classes of growth hormones, peptides. One is called GHRH analogs, that's on the left-hand side of the screen. And then the other one are called secretagogues or growth hormone secretagogues, GHS. So bear with me for a second. I'm going to make this simple. But like I remember I said, the brain makes growth hormone. But now we can get a little bit, more detailed about this as we kind of move forward, right? So the hypothalamus produces a hormone called growth hormone releasing hormone, which then goes to the pituitary. And the pituitary is actually what releases growth hormone. So the reason why the peptide in the left side is called growth hormone releasing analogs is because they're literally mimicking the growth hormone releasing hormone that's produced by the hypothalamus, right? So the specific peptides in this category, they're going to go to the pituitary, they're going to go in the receptors that growth hormone releasing hormone would naturally go in, and they're going to release and press a button so that the body produces growth hormone. Growth hormone then travels to the liver. The liver produces something called IGF-1, insulin growth factor 1. Very, very important marker for us to look at in the blood work to make sure that you're a candidate too for getting growth hormone, because we don't want, if this is really, really high because of poor diet and things of that nature, we don't want to amplify this at all. The liver produces insulin growth factor 1, and then it's what basically causes the cellular results or the effects like muscle growth, fat loss, recovery, anti-aging effects. All these peptides have wackadoodle names, okay? So bear with me, but the common peptides on the left-hand side is CGC-1295, sermorelin, and tesmorelin. On the right-hand side, we have growth hormone secretagogues. The end effect is the release of growth hormone. One on the analogs go directly to the pituitary to release it. Now, the secretagogues, they act a little bit differently. They're acting on a hormone you may have heard of. It's the hunger hormone called ghrelin. Ghrelin is actually produced by the stomach, and it tells the body that I'm hungry, I need some food. And ghrelin will go to receptors on the hypothalamus and pituitary to stimulate the body to produce growth hormone. So, like when I was learning about this, I'm like, why? What does that even mean? How does that work as far as like giving somebody a peptide that's going to mimic the stimulation of ghrelin? Well, it's kind of a survival mechanism, right? So if the body thinks it's not getting food, what will it do? It's going to break down fat to release ketones to be used as energy, and it's going to try and preserve muscle. And so this is a different mechanism because this is kind of like turning on the volume switch, right? So when you combine these two types of peptides, right? So on the right-hand side, the most common peptide that's used is called ipamorelin. But when you combine them, which is really best practice, so people will combine one GHRH analog with one GHS analog, you're getting the button push to produce growth hormone, and then you're getting this other amplification from the ghrelin side and some of this survival mechanism. And so it actually amplifies the effect of the growth hormone that's being produced. Okay, that was a mouthful. The bottom line is that we're mimicking the production of growth hormone by using peptides. And when we look at, the power of growth hormone peptides, it will help with lean muscle growth, fat loss, and body composition. It does help with energy. It helps with recovery. It does help with brain and cognitive support, helps with better sleep and hormone balance. Specifically, as we get older, we're decreasing the amount of hormones that we're producing. And a lot of times there's a marker in our blood work called sex binding hormone globulin that goes up. It's stealing our hormones. And this really helps, these peptides really help to allow the body to use the hormones that they're making. Again, we're not knocking down the door by giving somebody hormones. We're actually knocking on the door, right? And so what we're doing is we're actually making the hormones that we're already using more efficient, which I think is, working with the body rather than against it. It helps with immune longevity. And it does help with skin elasticity. That is one of the big things that's usually shown with these growth hormone peptides, right? We see muscle increase, visceral fat loss, we see skin elasticity, and you see better sleep. Those are almost always reported by taking these peptides. All right, now we're moving into a really big topic here, right? This is, the weight loss peptides, right? And as we move into this, there's a lot to say here. But one of the interesting things, when we work with patients over the years, if you're following diet and lifestyle and you're giving this 90% commitment over 90 days, 3 months, 6 months, you're going to see results. There's no question. You're going to see objective results in your blood work, and then it's going to bleed in subjective, you'll notice it subjectively in the way you feel, the way your skin is lighting up, and, the weight, etc. But there are outliers, right? There are people that the body is metabolically confused and it's biologically defending body weight. It truly is biologically defending it. So if we look at just a couple of these hormones here, right? Ghrelin, like we said, is a signal for hunger. Leptin is made in the fat cells, and it tells the body when there's enough fat. It says, "Hey, listen, we're full. We have satiety." Insulin helps to take sugar out of the blood. Glucagon helps to put sugar back into the blood. But what happens, and you can think about a couple scenarios here, right? See a lot of people at the gym who look good, have a belly, they work out 5 days a week, and they do a lot of drinking on the weekend watching football. And so they have, their healthy fat, right? I see a lot of people who come in and say, I have been eating really healthy, I've been exercising, and I cannot lose weight. Now, this is a really important thing to remember. The body doesn't respond to effort, it responds to signals. So, from an outside perspective, the person thinks that he's putting in an amazing amount of effort, but inside the human body, it doesn't feel safe. It feels like chaotic. You're on 10 diets over the last 10 years or 5 years. You're switching back and forth, even though you might be eating healthy. So the body gets confused. And so it biologically defends because it feels like there's a threat. You get sympathetic dominance. And then we add on the emotional component of shame, blame, guilt, body image, emotions, limiting beliefs that we can't lose weight, and the inconsistency that I talked about. And this is a real phenomenon, biologically defended body weight. And the answer to get this done naturally, even without a peptide, is consistency, safety, security, loving the body, and waiting for that key to turn when the body feels safe to let go of the weight. Now, these peptides really work well on these metabolically confused individuals and the biologically defended body weight. They work extremely well. And so in order to understand, to understand the medications we'll talk about in a second, and I'm going to give you some hints on, what ones are better to use and how to use them. Again, it's really important to understand the gas pedal and the brake pedal. So just as we talked about growth hormone, now we're talking about metabolic health, which is really, the regulation of sugar inside the cells, how the mitochondria takes the sugar and burns it for energy and fuel. So on the left-hand side, we have a hormone called insulin, which is produced by the pancreas. And when we have an increase in sugar, which would happen after you eat a meal, the insulin is like a boat, and it goes and it takes the sugar and it delivers it to the cell. It dumps it into the cell. The mitochondria uses it, burns it, for energy. Any extra sugar that's kind of lingering, right, gets stored in the liver and the muscle as glycogen for a rainy day. When you're not eating and you need to break down sugar, it's stored for a rainy day. And any sugar, if you ate a bagel and a donut and you ate way too many calories, right? All of that excess sugar, once it's stored as glycogen, the body takes that extra sugar and will turn it into triglycerides, circulating fat. And eventually, circulating fat gets stored as adipose tissue or fat tissue. And that's how we get, the connection here with, triglycerides and cholesterol and all of that stuff starts building up. They're all kind of working on these same pathways. But the end result of insulin pathway is blood sugar decreases in the blood. Insulin levels, right, promote fat storage, inhibit fat breakdown. And then when we look on the opposite side, if we haven't eaten or fasting, we have low blood sugar, right? And so there's another hormone. It's called glucagon. And glucagon tells the body to take that stored sugar, which is called glycogen, break it down and release sugar into the blood. So the end result is blood sugar increases to a healthy range, right? So glucagon promotes fat breakdown, releases fatty acids for energy. And it's the Goldilocks rule again, right? We need both. We need the insulin pathways and we need the glucagon pathways. And if we look back, right through here, right, when things could go wrong, the communication signals get all mixed up, right? So ghrelin is no longer telling us really when we're hungry, it's telling us when we're emotionally hungry. Leptin is tricking us and it's not giving, there's something called leptin sensitivity, right? So we're always hungry. Even though we have enough calories, we can get insulin sensitivity. The thyroid gets messed up with conversion issues. And there's so many different things that can potentially happen. But the bottom line is it's chaos. It's a miscommunication that has been developed because of the signals that we've been telling it for years and for decades. So this is kind of your, take home slide for the weight loss drugs that are currently out there. We have GLP, which stands for glucagon, which we just talked about, like peptide. So what does it do? It increases insulin, it decreases glucagon, it potentially lowers blood sugar, it reduces storage, increases burning, promotes fat loss. It has a strong satiety effect, just like, leptin, and it slows down gastric emptying. So it makes you feel full and it creates, again, that satiety type of signaling. So that was really, GLP was discovered in the 1980s. It was approved in 2005 for diabetes type 2, and it wasn't until 2021 when Wegovy, which is just the brand name for GLP, was approved for weight. And since that time, of course, everybody started taking just a GLP agonist, right? Glucagon like peptide. But then they had the advent of, say, combining GLP with GIP, which is glucose dependent insulinotropic polypeptide. And it has similar effects. It kind of amplifies when both of these come together, it amplifies the effect of both of them. So we have an increase, it's a stronger increase, a stimulator of insulin. It does lower blood sugar. It doesn't promote necessarily fat loss, but it enhances fat utilization, really, of how our body is using fat, like in the blood. It has a mild to moderate effect on satiety. It has a minimal effect on gastric emptying. And then the new medications that are coming out. So the first was just GLP by itself. The second line of medications was GLP and GIP. And the third line of medications that are coming out are combining all three of these, glucagon. And this does the opposite, basically. It decreases insulin secretion, it increases glucagon, it raises your blood sugar, it mobilizes fat for fuel, it speeds up, the gastric emptying, so it kind of can mitigate some of the negative effects of the gastric, emptying effects of GLP and GIP. But if you're like me and you're kind of thinking about this, like, how is these sound like all mixed up signals? How can you combine all of these? And isn't that more metabolic confusion? So, what's happening when they're combining all of these medications, you're actually getting what's referred to as metabolic flexibility. Now, this only works really if behind it you have the diet and lifestyle to back it up, because the consequences of not having the diet and lifestyle behind this, we don't know yet. And so you don't want to be one of those experiments. But GLP is like the brake. It reduces your appetite, slows digestion, controls blood sugar. GIP is the steering, it's managing nutrients and fat utilization. And glucagon is releasing the energy, right? It's burning fat. So, if you're exercising, great. You want to be able to push on the gas pedal. If you're sedentary, you want to do the brake pedal. If you're, kind of in between, you want to do the steer. You want to have the metabolic flexibility as long as you're doing the dietary and lifestyle excellence, behind it. So GLP only single agonists, the generic name most people have heard of is semaglutide. The brand names are Ozempic, Wegovy. We have GLP and GIP. This is tirzepatide. The brand name here is that most people are using is called Zepbound. That's probably the most common drug right now that pretty much everybody is using. And then we have Ray 2 Trutide. I gotta pronounce that the right way. This is up and coming here, the newest frontier in the metabolic medicine. This is combining all three. Now, when we look at a deeper level, right? When in our office we run these GI map tests, and there's two dominant phyla that make up about 90% of all of the commensal or microbiome or good bacteria in the human body. They're called Firmicutes and they're called Bacteroides. And an interesting thing is that when Firmicutes is dominating over Bacteroides species, you get a problem with GLP production and you get an increase in insulin resistance as a separate mechanism, even if you don't have diabetes or prediabetes. You're getting it primarily from the gut microbiota. And so some people, I don't want to work on peptides. I don't want to take peptides. I want to work on finding a way to make my body make peptides the right way and return the signaling. And one of the ways that we can do that is targeting the gastrointestinal tract so that the body begins to make its own GLP, returning the body out of that metabolic chaos and beginning the process of returning normalcy, right? Remember, it's all about safety and security to get rid of that metabolically held weight. I'll talk about, some best practices, with GLP and GIP at the end there, as far as, things, or if you guys have questions, about microdosing and when you should take full dose, how long, things like that. We'll talk about that at the end. The next category I want to talk about is repair, regeneration, and beauty. And there's really three big players here. There is BPC, TB500, GHQ, Cu, which is a copper element that's tied. So it's a copper peptide. So these are the three big players, right? So let me give you kind of the 10,000-foot view, combining all of these three peptides, which some people call the GLOW protocol. If you combine BPC 157 with TB 500, it's called Wolverine. But in general, what's happening is BPC is sending out the signal. There's an accident, there's an injury. It's the 911 call, it's a first responder. TB 500 is clearing the roads, allowing the nutrients, allowing the fibroblasts, the different cell types to get to the injury. And then GHQ is the actual reconstructed team. It's the guys that are on, they're there. They're the ones that are working with their hands, trying to rebuild and to get things moving in the right direction. Now, if we look at it from a global perspective, what's happening is we're getting all of these are basically creating an anti-inflammatory effect. We are getting something called angiogenesis, especially with BPC 157. Angiogenesis, whenever you have an injury, we need to bring blood supply to the area. So it's increasing angiogenesis, the formation of new blood vessels. We're getting an increase in NOS or nitric oxide production, widening of the roads, right? So with widening of the roads, we're getting basically this increase in nitric oxide production, which is the gas that helps to vasodilate or widen the roads. And then we get things that inside the cells, there's these actin filaments that help and allow the cells to move, to change shape and travel. And TB 500 specifically works on these actin filaments in order to get the cells to move to where they're needing to go. And they also help with neurite outgrowth or nerve tissue. So they're helping to restore, nerve communication, to the area. So the way that I always think about it, from a macro perspective, if you're looking to heal muscles, ligaments, tendons, kind of larger elements in the human body, you're really looking at the BPC. And if you're looking at more of the micro, the collagen and the elastin, those type of elements, skin and hair, you're looking at the GHQ. So GHQ, has been around for a while. It's in a lot of, products, especially like creams for anti-aging. But it's a naturally occurring copper peptide that signals your cell to repair, rebuild, and perform at its best. And it specifically can help with skin rejuvenation by boosting collagen and elastin, reducing fine lines and wrinkles, improving firmness and elasticity. It enhances tone and hydration. And then it also helps with hair revitalization, stimulating hair growth, increasing thickness and density, reducing the shedding, improving scalp health. So it has a huge aesthetic, level. It works on the extracellular matrix, right, where it's allowing and providing for the scaffolding. It's working on, again, the collagen and the elastin. And it also has been shown to activate close to 1,000, different types of genetic pathways. And so it really helps with not only aesthetic, but at a micro level, it's the stitching that's occurring deep within the tissues. We obviously are not going to have time to go in depth on every single peptide, so I'm just going to give you a little bit of some of the highlights of some of the other big peptides that are out there. PT141 is one that is used a lot of times right before sexual activity to help intimacy and sexual wellness. It's working at the brain level to enhance sexual desire. And, we always, like we talked about, diet and lifestyle, this is a good one to pair with, amino acids like L-arginine and L-citrulline and beet supplements too, because, with intimacy and sexual wellness, it's not just about the signal. You also have to have, increased vasculature, right? So you want things to help with increasing vasculature to your sex organs, right? MOTS, mitochondrial optimization. Mitochondria, again, is the little warehouse that's found in every single cell, and it produces energy. This is a pretty amazing peptide because it mimics the signals your body naturally produces during fasting and exercise. So hint, hint, what type of thing should you be doing when you're taking this particular peptide? Well, fasting and exercise, because that's what it actually is mimicking, right? So it has a way to enhance, helpful with mitochondrial optimization. So it could even be put into, an anti-aging. But mitochondria gets overridden a lot of times, something called the cell danger response in autoimmune type of reactions, infectious diseases like Lyme and mold toxicity. The body is overtaken, and the mitochondria is overtaken, and ATP is no longer using as an energy source, but it's using it as a distress signal, and it's shutting down the cells. It's almost like, you know, the hurricane is left and you're trying to get food in, but the doors are still closed. And so you're locked up in your house and you still got the windows boarded. You're not letting anything in. And that's what happens, after you do get an infection and now it's turning chronic or autoimmune that was once acute, now it's chronic. The cells are hunkering down. And so this has a real strong potential with helping with a lot of autoimmune related issues. Epitalon, this is a synthetic peptide that mimics a peptide that the body produces in the pineal gland. It protects against cellular senescence, which is basically when cells go rogue and they become zombie-like. If you're not fasting, typically the body comes in and clears these cells out. This helps to protect, cellular senescence or, just aging of cells. It also helps to protect and increase telomere length. So this has a direct effect potentially on longevity. Telomeres are like the shoelaces, the ends of a shoelace on your chromosomes. Thymosin alpha 1 can be very helpful for any type of immune dysregulation, everything from autoimmunity, immune dysregulation or low immunity, or even hyperactive immunity. In general, right, your immune system produces B cells, which are, they make the antibodies, they go around tagging the body. And then the T cells look for the tags and kill it. But sometimes things can go wrong. You can have the body tag the wrong things. And sometimes the T cells can go rogue and they can, disregard the signals, of the antibodies that were tagged, and they can start doing their own thing. Thymosin helps with immune regulation, right? Especially, particularly of T cells. Glutathione is actually a peptide produced by the liver. It's one of the strongest antioxidants in the human body. So there's something called oxidative stress. This is production of free radicals in the body. And there's an idea from an aging perspective, the more antioxidants you have in the body and the less free radicals, you're aging gracefully. The more free radicals you have in the body and less antioxidants, you are increasing the amount of, aging. So antioxidants are good guys, right? They're found in fruit and vegetables. And they're like vitamin A, vitamin C, vitamin E, resveratrol from grapes, lycopene from tomatoes, all sorts of different things. And free radicals is what they're going after. These are the bad guys. So it's like Pac-Man going over or trying to find the free radicals. And that's what oxidative stress is the overproduction of free radicals. You'll produce free radicals, when you're exposed to smoke, or you'll produce it when you're exposed to environmental toxins. When your mitochondria is not working healthy, you're going to produce a lot more exhaust. NAD is a peptide that really helps at the mitochondrial level again. It helps to transfer electrons so that the body can produce more ATP. It specifically uses B vitamin B3. And it also is used or increases a lot when you exercise and you fast. So these are good things to pair when doing these types of peptides. And then there are, brain optimizing peptides. There's one called Salank and CMAX, and they're working on different neurotransmitters. C-Lank is working mostly on modulating GABA and balancing serotonin and dopamine, so it helps with stress and anxiety. And the Cmax helps with memory and learning and mental acuity or focus. All right, we're moving along here. Routes of administration. Now, this is changing, right? So peptides, because they're made of amino acids and because our digestive system's goal is to break down carbs, fats, and proteins, right? When a peptide goes into the oral cavity, excuse me, the digestive enzymes that are produced first in the mouth and then later on in the stomach with the acid and then in the small intestine, they get broken down, right? So a peptide gets broken down into single amino acids, so it's no longer a message. So the only exception to that is BPC 157. If you remember, that one is the one that helps to stimulate growth. And believe it or not, it's actually made in the gastric juices in the stomach and the duodenum. And so, you imagine your stomach, the mucosal lining is filled with acid, and the acid could, break down like rocks, and it's destroying your cells all the time. How do you get all this regeneration? Well, you get it in part by one of the key elements is BPC 157. It helps with regeneration. In fact, during wartime, when they're trying to save severed, fingers and limbs and things of that nature, they would put them in gastric juices, and they weren't really sure what was the mechanism, but it was BPC 157. It helped to keep that particular finger that was severed, healthy and alive until a time where they can put it back on. The most common route is injections, and that's going to be your strongest route. Oral, there are some. BPC 157 is one of them. Troches and sublingual is another route. Another really popular route, one that we use a lot in the office, is called transoral. Transoral is basically just meaning that you're putting it on the roof of the mouth. So you're trying to minimize all contact with saliva, because remember, any type of saliva is going to break that peptide down. So when you put it on the roof of your mouth, you'll get some loss, to saliva, but very minimal as compared to sublingual, and it goes right into the bloodstream. It dissolves. It's like a little strip of paper that you put on the roof of your mouth, and it dissolves within, 30 seconds. It's really quick. And then there's also nasal spray route as well. All right, peptide sources, really important. So listen up, and I'm going to give you a need to know slide. I think it's on the next one as far as what you need to look for. But let me just kind of paint the picture here so you kind of get an idea. We have prescription peptides, right? These are FDA approved medications, and prescriptions in general are for diagnoses, right? It's the treatment of named diagnoses, right? And so, insulin is a peptide. Sermorelin is used for people who have, if you remember, that's one of the growth hormone analogs, but it's actually used as a prescription for people who have growth hormone related issues or pathological, related issues. And of course, it has strict quality control. It's clinician prescribed, and it's standardized. And so it's very safe, right? In that perspective, as far as not having contamination is what I mean. The supplements are not FDA approved, and that's by design, and we want to keep it that way, right? That doesn't mean they're bad, right? I mean, a multivitamin is not bad. It's just not FDA approved, meaning it's not approved for treatment of disease. It's actually used for something else called health, right? So we want peptides to enter into this category, and they are. Collagen is a peptide. BPC is, you can find in supplemental form. GHQ you can find in supplemental form, and they support wellness and normal function. It's semantics, right? But they're not treating diseases. They're supporting wellness. And quality varies greatly, by brand, but again, it's not intended to quote unquote treat disease. There's also the black market. There's no oversight, no guarantee. So, you take the GLP medication as an example. If you don't have insurance, it could cost you $200-300 a month, on the medication or the injection. But, you'll probably see, pop up on Facebook, get your GLP monthly medication for, $30-40. You got to be careful because it could be from the black market, and it's purchased cheaply. There's oftentimes overseas. There's oftentimes no regulation. We had a patient that did this for GLP, and they were sent to the hospital. The issue here, right, has to do with risk of contamination with something called liposomal polysaccharide, which are basically toxins produced by bacteria, which sent the person, to the hospital because it's unknown purity. They're not testing for purity and potency. It might be in there. The GLP might be in there. It might help, but there's an enormous amount of contamination. So you have to be really careful. The other thing with black market and gray market, which we'll talk about in a minute, is that they come in powdered form. So prescriptions will come already what they call constituted. With gray market and black market, it comes in a powdered formula. You got to buy a separate liquid called bacteriostatic water and combine them. And it's very simple to do. And then you would be able to inject them. Now, remember, prescriptions are for treatment of diseases. And when we're talking about gray market and black market, we are talking about semantics when we say they're for research use only. It's like walking into a health food store and seeing goat milk. If you've ever been to, health food store, you've seen like a case of goat milk, and you'll see something. It says, "Not for human consumption, for animal consumption." Right? This is in quotes. I'm saying, right, because people are buying it and drinking it. They're just not allowed to sell it for quote unquote human consumption. Gray market and black market is for research use only. It's sold for research purposes, but often used by individuals, and it's not approved, quote unquote, for human use. It's more potent than supplements. It's the actual peptide, and it can be extremely safe to use if you follow the following guidelines. And this really applies pretty much to, across the board to prescriptions and supplements, as well as the gray market, right? You have to have a third-party certificate of analysis called a COA. This is an independent verification of identity and purity. Number two, you have to see that there's batch-specific testing, basically ensuring that that lot number, what's in that vial, matches that exact lot. So what's in there is what is they're saying is in there. You want to make sure that it's tested, for sterility and endotoxin, or that LPS. And then, kind of a standard for supplements too is CGMP manufacturing standards. This is what we refer to as current good manufacturing practices, right? Meaning that it's produced in facilities that follow very strict controls, and they're monitored, as well. And so you can guarantee the potency. Who should not take peptides? Well, they're powerful, but they aren't right for everybody. So there's some pretty, I think common sense categories here, but people who have active cancer, it's not proven, but it's theoretic in that if you're increasing angiogenesis, if you're increasing growth hormone, and you have, abnormal cell growth, it's potential that it can increase the growth. Pregnancy and breastfeeding, literally everything is contraindicated with pregnancy and breastfeeding. Uncontrolled medical conditions, severe uncontrolled liver dysfunction and diabetes and cardiovascular disease, you got to be really careful. Autoimmune, a lot of peptides can be used really well for autoimmunity. There's a lot of people that have uncontrolled autoimmunity, so it kind of falls into that other category there. So this is something you want to make sure you're being guided by a practitioner. Individuals on certain medications, if you are doing the right thing, following first things first, second things second, it's very potential. If you are on medications, you may have to get off some medications because it might work so well, right? So you need to be monitored, right? That's, one positive effect. But then there's, a lot of, sometimes there could be contraindications with certain medications, especially, you're taking GLP and you're already on blood sugar medications. That's not a good idea. And it's a no-no, right, for people looking for a quick fix, right, that are not willing to make proper diet, lifestyle changes. I mean, we don't know what the risks are, but I could tell you that they're going to be amplified and they're going to be tenfold in people who are not doing the fundamentals. So, what I want to leave you with, right, is just some ideas here, and you can take the quiz that I provided for free, and we'll send you a little mini report on maybe some of the top peptides that you could use. But if your ultimate goal is to heal the musculoskeletal system, you're looking at the BPC, right? That's the 911 call, the TB 500, that's the widening of the roads, and GHQ, that's, helping with the collagen and elastin. Those are really good choices. If you're looking to lose weight, those are the GLPs, right? And right now, it seems to be that combining GLP and GIP are ways to go. But if you're not willing to put in the work, this is a no-no because the side effects of GLP long term can lead to gastroparesis, where your stomach is no longer working. It could, in some cases, lead to thyroid cancer. It can, like we talked about, you can have a severe amount of muscle loss, all while you're proudly displaying the fact that you lost weight in the mirror. That's not a good idea. There's something called personal peptides. You can combine some of these, GLP peptides with like B12 and NAD. And so you can actually get very specific. You can use them along with GH support to maintain muscle integrity. And that's actually being popularized right now too, is using both of them. You're wanting to make sure that you're taking the right type of nutrients with all these peptides, right? You need to make sure you have the right nutrients, like we talked about, that are going to supply, because these are signals, right? You got to make sure you're supplying the right nutrients. And so you might not be hungry, but you still got to eat. And you got to make sure that your diet is that the diet that you're eating and the meal that you're eating, if you're only eating that one meal, is extremely nutrient dense. You can't just have a bagel for the day. You just can't have an apple. Like you have to be eating healthy. You need to potentially be taking, you know, protein powder, as well to really help support, these different areas there. And then when you meet your target weight, that's the time to talk about microdosing. Now, if you don't have a lot of weight to lose, or you're looking at body composition, or you're more in the realm of 20 pounds or so to lose, or 15 pounds, that might make more sense to go with the growth hormone analogs. Of course, if you're looking to gain muscle, if you're looking for, sleep and recovery, you're looking at hormone optimization. This is really where, you want to consider, the growth hormone, analogs. Optimization of aging. A lot of these peptides fit into this category. GHQ certainly would because of its aesthetic, on skin and hair. Epitalon, NAD, anything honestly that supports the mitochondria is going to be considered, anti-aging and longevity. And then if you have immune-related, issues, this is where that thymosin, alpha-1, could become very helpful. Again, the bots for the mitochondria, NAD. So there's a lot of overlap here, right? And that's why I put together a little questionnaire to kind of help maybe, what are the top two peptides that you can take? Because stacking is very popular, meaning you want to stack peptides that work synergistically. What I believe the trend is, turning into is, and you want to avoid this, is, I'm going to take a peptide for my weight, and a peptide for my sleep, and a peptide to heal my musculoskeletal system. I take a peptide for my autoimmunity. I'm going to take a peptide for my hair. No. And that's kind of where it's going. It's like every day they're coming out with a new peptide for a very specific function. What I want you to think about, and this take home message here, is really thinking about how can I make the effect with just a few peptides alongside diet and lifestyle. That's the big picture. You don't want to be thinking, how can I take 10 peptides? How can I avoid eating healthy and exercising and just get the results that I'm wanting to? That is not going to work. And I can tell you right now, rules of reasonableness and common sense I always talk about is going to lead you down the wrong track. So I'm going to stop talking and open this up to questions. So let me.
So I just wanted to say that that was absolutely awesome. If you are here tonight and feeling like that was a lot of information, just take it in with ease, right? One thing at the time, and then you can always go back and listen to the presentation again.
I have a question.
Yes,
So,
ma'am.
and
Hey,
that was
Donna.
that was terrific. Okay. I might have missed this. Okay. Help me understand this. So you said I know there are many peptides out there in the market, right? But you also said that the body naturally produces peptides. Does the body also produce different types of peptides?
Yeah. So sorry, and that might have gotten lost in translation, but you know amino acids, right? There's all different types of amino acids. How those amino acids are strung together. So let's say that, there's tyrosine, tryptophan, and, leucine, or that order somehow is conveying make growth hormone. But if you add an extra peptide, or I'm sorry, an extra amino acid, it conveys a totally different message. And you add another amino acid. So, I mean, the DNA is doing this all the time. It's getting information from the environment and it's basically pushing out peptides. Okay, we need a signal to say this, and it's spelling a sentence
Mm-hmm.
that's spelled through a sequence of amino acids. So the body makes, they don't know, tens of thousands of peptides potentially, right? And right now, maybe they have their hands on about, 20 or 50, that people are talking about today. But I don't know if that answered your question.
It does, because I think what you're saying is the body knows which ones to produce, or it produces something that, and it just distributes, right? So how do you know if, like, how would I know if my body is not producing sufficient peptides or it's lacking in one thing?
You don't. And that's why, I jumped onto this whole peptide bandwagon, from a health and wellness perspective, because it's like, we don't know. We're playing. Okay. And it's relatively safe because the body, is making these peptides, right? So, but the thing is, we want to make sure we're respecting. And so, one of the things that we do with the peptides, or we've been doing with patients, right, is called, cycling. So you take a peptide for 5 days, you don't take it for 2 days. You take it for 5 days, you take it for, don't take it for 2 days. You do that for 3 months, then you take a month off. And maybe you do a couple rounds a year until we
Mhm.
get further information about like I'm taking peptide, the growth hormone one, right? I'll do it maybe a couple rounds this year, right? But I'm not going to do more than that. We don't know. We don't know. And, but peptides are relatively safe. Right now, people are using them like crazy. And, there's not a whole bunch there's a lot of animal studies, but not a lot of human clinical studies. A lot of the weight training, area has been using them for years with positive results. So it does appear like there's a lot of safety and efficacy, but we also see people taking GLP, and I have people, their doctors are telling them, take it forever. Really? You want your stomach to not empty forever? Like,
Right.
no, that to me makes no sense. And that's why I think even though some of these are, prescriptions, the holistic world has to come in because, a lot of times they just don't use common sense. And that's a perfect example. You can use it to jumpstart somebody's weight loss, 3 months, 4 months, then microdose and really concentrate on the diet and lifestyle, after that. But so yeah, they can be used very inappropriately, and they are being used inappropriately.
Okay.
But there's no
Thank you.
really, I have in the blood work when we're doing blood work, and I know you're doing blood work with me, so this is something we'll bring to the table. This is new that we're working with patients, but there are some markers that we can look in the blood work: glucose, hemoglobin, A1C, insulin, that gives us information about the effect of peptides. We can't measure the peptides, but we can measure the effects. Insulin growth one factor, is it too high, too low? Which would give us an idea that, what, it might be a good idea for you to try XYZ peptide. So the blood work, we're working on that, like what signals, right? Because this is fascinating. It's all based on physiology. That's really all it is. So it's using the intelligence of what, I've been taught, and then applying that in real world examples and doing it in a very safe way.
Okay. Perfect. Thank you.
Hey, Dr. Rapoli, it's Tammy.
Hey, Tammy.
Obviously you've got that full blood workup we did on me. I think it was November last year. And I'm assuming based on what I heard you just say that we could go back to that and now apply this webinar that we just talked about with these peptides and kind of look where I was on ANA, those types of things, the immune situations, and apply what you're saying, or do I need like a fresh test,
That was what, like a year ago?
No, it was was it November? I think it was November. So I don't know if could we go, is that reliable enough to go back and apply what we've just talked about tonight to get an idea of maybe something that could help me, or would I have to go and do all new blood work?
Well, you've already changed a lot of stuff, so you may need new blood work.
Yeah,
Right.
I think it's, and again, this is again my opinion, okay? Because when you go on telehealth and you go on these, MD clinics and all of these areas, zero blood work is needed to get a peptide. Zero. Okay.
Yeah.
That's how confident the medical world is of safety and efficacy of peptides, right? It's a little bit, kind of crazy, but I think, from my perspective, there are, depending on the person who's filling out the questionnaire and what's showing up there, how much information is provided, there are some peptides that could be used, potentially without blood work. But I think the general feeling that I have is that you need new blood work within the last 3 months to really determine what is going to be the best fit for this individual. And so that's kind of my general idea right now.
More questions too over in the box, chat box too. If let me go back up. Alex, I think it was, had a question.
Hold on,
How, yeah, I was gonna say also it was how old does somebody need to be before they can start a peptide protocol?
we wouldn't apply it to anybody under 18, so you have to be over 18.
Let me find it again. Please discuss the upper age limit for starting peptide regimen.
I don't think there is an upper age. And in my opinion, we
I
want to
didn't think there
optimize. I don't
was.
care how old you are. You
Yeah.
want 90, you want to live to 120. So I don't think I mean, it's based upon medical necessity and what's needed. But, we look at everybody as we wanting to optimize them for a day, a week, a month. It doesn't matter. So everybody has the same opportunity, I should say, whether or not it's the right thing to do. I mean, that's just something you would depend on, an elderly patient, or somebody in their 90s or something like that, if it makes sense. There's a question: if a family member developed collagen-induced colitis,
Right.
and autoimmune was discovered, would this be a case where the person either did not follow a proper diet and lifestyle? in conjunction or potentially took the wrong version of a peptide.
Well, can you explain the collagen peptide? Because it's definitely very different sometimes of what it needs to actually absorb.
Yeah, I'm not a big fan of collagen peptides, because again, when you think about physiology, a lot of people are taking collagen. You're better off taking amino acids than you are collagen. Collagen is made up of amino acids, and what happens when proteins enter into the body? The mouth breaks them down into amino acids, the stomach breaks them down into amino acids, and the small intestine, the digestive enzymes completely break them down into amino acids. So when you take collagen via the mouth, it doesn't enter the bloodstream from the small intestine as collagen. It's amino acids. And then the body has to recombine them to make collagen. So you're better off taking GHQ and amino acids any day over taking collagen. So I'm not a big fan of taking collagen as a supplement. So I don't know, about inducing colitis or autoimmunity. I've never heard that, Annie. So I don't really have an opinion on that. I don't think that's something that could be induced potentially by collagen because it's really just amino acids. So I don't see how that could happen. But anything is possible. I never say never.
Well,
I want to ask about a stack I believe is called Glow. Yeah, Glow is BPC, TB500, and GHQ. So that is again, the 911 call, opening of the roads, and then the workers, right? Thickest in my brain. And that's the Glow stack. The Wolverine stack is just, again, these are crazy names here, but it's BPC and TB500. I am paraplegic and need of repairs. They said I would not walk. With a few bad falls. I want me back. I want you back too.
yeah.
Yeah, that's something that would be really interesting to explore, with the peptides, right? Especially the mitochondrial peptides. I mean, to be honest with you, a lot of them, come to mind because you want to have neuronal growth, you want to have repair, you want to have muscle strengthening. And so that would be definitely a discussion, to kind of see where the best, place to start is. And so be happy to talk to you more, about that and whether I can help you or I can get you into the right hands.
Another question too about, hold on, it's up the feed a little bit. I think it was about prostate and
Okay, I see it. Yeah. Please
yeah.
address, this is for Alex, if he's still on. Please address safety of peptides for use by somebody who's had a prostatectomy. Okay, so they had their prostate removed. So I don't know, obviously the medical history there, and that's something we can discuss, privately, but I'm assuming the prostate was removed because of cancer. And so that is definitely a red flag, for some of the peptides that increase growth and angiogenesis and that nature. So it would be really a discussion to see if it's obviously active, did the person clean up their diet? Are they on the right track? Is their blood work markers not showing the inflammation and the cancer promotion? Where is the PSA levels? Like, I think hard to know just based on that.
Gare was asking about the GHQ in tablet form, but honestly, it's easy to take it in that upper, the troche, just because it dissolves faster than the tablets. And you wouldn't have to do an injection with it, but John can probably shine a light. I know that's what I use, is the one that goes over to the mouth.
So Sermorelin, GHQ, BPC 157 have all been they've done enough work to make them oral. And so you can actually use them pretty well orally. I don't believe, of course, they have the same potency as obviously if you did an injection, but no, those are ones that have crossed the bridge and they've figured out how to protect them throughout the gastrointestinal system. They've even made GLP oral drops, liquid drops now too, especially with the microdosing. So this is going to change, for people watching this, months from now and things of that nature. This is rapidly changing as far as the routes of administration. And so, no, GHK can be used orally. There's a couple companies out there that have been able to put it in an oral form. So, yeah.
But the passing the gastral tract is probably going to be the most powerful, like the injection or in the mouth where it dissolves.
Epitalon, Gary, yes, there is an oral. And it is, there is an oral that you can take for Epitalon. So, yeah, there is one. That one, I believe, Quicksilver has it. All right, so what's going to happen is if you guys fill out the questionnaire, like I said, this is not AI generated, so give us a couple days to look it over, and what we'll do is we'll make some recommendations for you on potentially the top 2 peptides. We're not telling you to take them. Like I said, you want to work with your practitioner, your doctor, but that way you can kind of see what the best ones are and where you can get them and things like that. So. Well, thank you, everybody. I hope that wasn't too confusing. I know there's a lot of information, with the peptides that can get a little overwhelming, but please, use it safely when you're going about doing it, and think about it logically. Like, how can you really work upstream to affect everything downstream rather than just chasing thousands of things downstream, right? I think then you're going to get caught in the medical world again of taking something that potentially can be beautiful, which is made by the human body, and then destroying it, right? Which, with the medical world getting its hands on these prescriptions and making them prescriptions, we really want to make sure that the peptides are moved into the supplement world, so we have control over it, rather than higher ups telling us what we can and can't take. So thank you so much, and we have another class coming up next month. It's an in-person. If you guys are local, it's going to be on hormone health. It's going to be on May 30th, and then in June I'm going to be doing a lecture on healing through A Course in Miracles. And so quite a diverse topic, 360 from what we're talking about here tonight. But that's going to be a webinar.
Amazing. Yeah.
Yeah, that will be a webinar.
Awesome.
All right, guys. Thank you so much. And we will talk to you soon.
Thank you, guys. Have a great night. So good to see you all.
Have a great night, guys. Bye-bye.